When we feel sick and want to get better fast, we usually turn to antibiotics as a quick fix to knock out these symptoms. But not so fast. Antibiotics help stop infections caused by bacteria. But there's no one type or a universal medication that can cure every infection. And it simply may have no effect on the illness you're trying to cure. What's worse, you may be unnecessarily subjecting yourself to various side effects that could do more harm than good. And while antibiotics are generally safe when taken appropriately, when and how to take them safely is very important as well. Today, we break it down for you. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program right now are Dr. Maria Lourdes Gozali. She's an infectious disease specialist from the Makati Medical Center. We're also joined by Dr. Ana Gia Limpoco, a family and community medicine specialist from the Philippine General Hospital and Manila Doctors Hospital. It's good to have you both on the show. Now, antibiotics kill bacterial infections, but not COVID-19, the common cold, and even the flu. Now, I'll start first with Dr. Gozali. Could you please explain to us why antibiotics work on bacteria and not on other organisms?
For each organism, there is what you call as susceptibility and resistance. So antibiotics are mainly for bacterial infections and viral infections, although really like varicella and CMV, they're the only ones that you can have antiviral treatment. But antibiotics are mainly for bacterial infections.
Okay. Now, Dr. Gozali, are there any clues that you see in patients that may prompt you to think that this patient is infected by a bacterial infection or a viral infection?
Yes, okay. So many times, the infections usually start as viral infections such as colds or headache or fever. If these are usually high-grade fever, if there's illness, or if there's a prolonged duration or a worsening of the infection, these are the suggestions that these are bacterial infections.
Okay, now using antibiotics appropriately and smartly is very important if we want to get the most out of it. And unwanted side effects along with antibiotic resistance are some of the concerns when it comes to using antibiotics. Now let's go to the do's and don'ts when taking antibiotics. I'll go now with Dr. Ana. Dr. Ana, what happens if a person stops taking the prescribed antibiotics because they started feeling better? Madalas mangyari ito. The doctor prescribed the patient for 7 days. Minsan, after 2-3 days, okay na yung pakiramdam niya, they stop taking the antibiotics. What happens when they do this?
Well, that's a common scenario that we see with our patients. No, we have to tell them that in 2 to 3 days, the symptoms may resolve, but it doesn't mean that the infection or the bacteria that caused the infection is already killed. So we have to tell them that they have to complete the antibiotic course, or if not, it may develop resistance, or worse, pwedeng mag-okay yung kanilang pakiramdam, but after a few days or a few weeks, mag-recur na naman yung infection.
Okay. Now, Dr. Ana, what if naman, another scenario, if a patient misses a dose, nakalimutan niya mag-take ng antibiotic dose niya at a certain time, or accidentally nag-double dose siya, ano ang dapat niyang gawin ngayon?
So we have to tell our patients that if they miss their dose, they don't have to double dose the next time they take it. So they just have to continue taking it and complete the whole course of the antibiotics. That's why when we prescribe, eksakto lang po yung number na pine-prescribe natin. If we give it for 3 times a day for 7 days, then that's 21 capsules or tablets that they have to complete it.
And taking antibiotics only when needed is important because it can cause some side effects. And these can range from mild to severe. Now, Dr. Gozali, what are some of the side effects common when taking antibiotics?
One of the very common side effects would be allergy. Okay, for any drug, whether it's an anti-analgesic or antipyretic or any medication, it can cause allergy. So a history of allergy has to be elicited. Another side effect is that antibiotics alter the microbiome, meaning it changes the organisms inside your body. So it doesn't only kill good bacteria, it kills also bad bacteria, so the microbiome is changed. With this, you can get diarrhea, you can get superimposed bacterial infections, with like Clostridium difficile, which is very hard to treat. Also, the other side effects would be there could be drug interaction. Also, they can have what you call drug fever. When the patient is being treated and getting well already, and suddenly develops high fever, chills, but in between episodes, they seem well. It could be fever or reaction due to the drug, even if the organism is susceptible to this. And one more thing that's very important is it can induce antimicrobial resistance. That is why for patients who take antibiotics for a simple cold or for a simple cough, they tend to be resistant. We tend to see a multi-drug resistant strains.
Yes, very important, definitely to know. And a common question always is, what if you're allergic to the antibiotic being prescribed to you? What do you do now? Which antibiotic do you take? We'll give you the answer in that in just a moment. You're watching MedTalk Health Talk right here on CNN Philippines. This is MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez. Some people may have an allergic reaction to antibiotics, especially to the penicillins and maybe the cephalosporins. In most cases, the allergic reaction is mild to moderate. Now, what happens to someone who's allergic to antibiotics? Dr. Ana, how can these mild to moderate allergic reactions be treated?
Okay, first, it's very important that the patients should tell their doctors kung may allergy sila to any antibiotics. That's very important. So, as doctors, we have to find that out. And then, we have to tell our patients that if it's their first time to take the antibiotics and they develop sort of rashes or feverish feeling or any side effects, they have to call you or they have to inform you about that. At the same time, you have to tell them that there are mild reactions to taking the antibiotics, as what was discussed a while ago. But if ever there's the occurrence of such allergic reactions, then you have to stop the medication, call your doctor, and the doctor should reevaluate and give you another antibiotic that will be useful for your illness or for your disease.
Now, in rare cases, antibiotics can cause an allergic reaction, which can start off as mild to moderate, but it can progress to what is known as anaphylaxis. Now, Dr. Gozali, please explain to the viewers, what is this anaphylactic reaction? What should our viewers know about this?
Yes, you should know that this is a very serious allergic reaction, hypersensitivity reaction. It can manifest as swelling of your eyes because of this edema. It can manifest as difficulty in breathing because your airway becomes tight. No? And then that's why like asthma, you can have bronchospasm, that's why you have difficulty in breathing. You can have also irregular heart rate. You can have what you call hypotension, the blowing of the blood pressure because your blood vessels dilate. So during this time, do not run, no? Because you can develop this what you call empty ventricle syndrome. Your blood pressure really goes down and then you will just collapse when you run. Also, you can develop, some develop high blood pressure, but some develop hives also. So those are the manifestations. This occurs usually within 15 to 20 minutes after intake of the new medication.
Now, follow-up question, Dr. Gozali. If a patient is allergic to a certain antibiotic, wala na ba silang hope? Ano bang next options nila for treatment?
Okay, so there are many kinds of antibiotics. There are beta-lactams, there are quinolones, there are tetracyclines. So you just have to shift the antibiotic to another class.
That's right. So it's very important that a doctor is the one who prescribes to you the antibiotic, because your doctor will be able to know which antibiotic you can shift to in case you are allergic to the one that was prescribed. Now, the choice of antibiotic mainly depends on what kind of infection you have. And this is because antibiotic is effective only against certain types of bacteria and or parasite. Now, still with Dr. Gozali, what are some of the factors that may determine which antibiotic you choose to use?
Number one is you have to choose an antibiotic that will cover the most common organisms for that particular disease. That is why you should know, for example, what are the most common etiologic factors in pneumonia, in otitis media, in sinusitis, for you to give empiric antibiotics. Empiric means you don't have the result yet of the cultures, but with the history of the patient, you know already what particular organisms will be here. So number one will be the spectrum. Number two will be your tissue penetration. So if you have the appropriate antibiotics and the organism is susceptible, but it cannot penetrate to the tissues. For example, there's meningitis, and you give an ordinary oral medication. This antibiotic will not penetrate the blood-brain barrier. That is why it is not effective. Also, if there's a lot of inflammatory material and infections such as abscesses, they have to be drained. Surgical drainage is important. So you have to look at those factors if there are factors which can decrease the penetration of the antibiotic to that particular tissue. Also, the safety profile. For example, you have to see also if the patient has some hepatic insufficiency or renal insufficiency, because antibiotics are excreted usually in the kidneys or in the liver. That is why if you have kidney insufficiency, do not give antibiotics which will be excreted in the urine. For pediatric patients, it's very important for the taste, because even if your medication is very effective, but if the baby keeps on vomiting it, you will not be able to treat the patient properly. And finally, the cost is always important as well.
Very important tips. Now, antibiotics can sometimes interact with other medicines and substances, meaning it can have an effect different to what is expected. And one thing that should be completely avoided is alcohol. Dr. Anna, can you explain why alcohol should not be taken when you're taking antibiotics?
That's a very important thing to point out. So a lot of patients will ask us if they take the antibiotics, is it all right to take alcohol also? So we have to tell them that there is alcohol and antibiotic interaction that may somehow have an effect in terms of the effectivity of the antibiotic. So there is such a thing that there will be an effect on the pharmacokinetics and the pharmacodynamics of the antibiotic. And this may somehow, number one, it may exacerbate or might worsen the side effects of the antibiotic to the person, at the same time also the side effects of the alcohol to the body. Number two, because of this, it lessens the effectivity of the medication. So it's very important that we tell the patients that if they take antibiotics, then they should avoid the intake of alcohol. Although in recent studies, there are some antibiotics that may have a minor or a lesser interaction in terms of alcohol intake then. But to be safe, we have to tell them that when you are on antibiotics, then don't take alcohol.
Now, improper use and abuse of antibiotics is also very common, and this can cause what we call antibiotic resistance. More on this very interesting and important topic when we come back. Your health always comes first on MedTalk Health Talk. I'm Dr. Freddy Gomez. The overuse of antibiotics has led to what we call antibacterial resistance. And bacteria adapt over time and can even become what's called a superbacteria or superbugs. And those pose a big threat because current medications, current antibiotics may have difficulty in trying to get rid of them or trying to control them. Now, Dr. Anna, how does antibiotic resistance happen?
For instance, if a person takes an antibiotic without the indication of taking it, so nagkakaroon na there's an effect on the body's bacteria. So it may kill the good bacteria in the body, at the same time the bad bacteria. And somehow, when this bad bacteria doesn't really been killed in the body, after some time, pwede silang mag-multiply. So the next time that the person has the symptoms of a specific infection or an illness, when you take the antibiotics, hindi na siya mag-e-effect. So nagkakaroon nagde-develop yung bugs, yung bacteria ng kanyang way to fight off the antibiotic that you are giving. So in time, it develops resistance. That's one thing that we want to address. Why? Because when we see patients in our clinics, most of them have already taken some sort of antibiotics before they see us. And sometimes, hindi naman talaga indicated to take the antibiotic. So we have to tell them that it may not be so helpful because it also contributes to the development of antibiotic resistance. So the next time, mahihirapan na tayong mag-control ng infection nila because they've already taken a lot of antibiotics without its indication or indicated use.
Dr. Gozali, how can our viewers prevent antibiotic resistance?
Okay. That is a very important question. Thank you. Number one is you have to isolate yourself, like what we're doing now in COVID. Try to avoid going out if it's not important. So isolate yourself. Number two is hand washing, proper hand washing. You know, the usual front, back, and then this one. You have to have the correct hand washing because if you don't wash your hands, you will be carrying these organisms. Also, you have to use the proper precautions, such as, for example, masks, face shields, and sometimes you have to use gloves. You must remember that these are very protective against some droplet infections, which is for the bacteria, but some viruses, including COVID, can be what you call airborne. So you have to wear the proper kind of mask, which equals the N95 mask. Okay. Also, vaccines are very important. When you prevent having an infection, that's why an ounce of prevention is better than a pound of cure. So if, for example, you vaccinate them as for influenza, this is a viral infection. But influenza changes the lining of your airway. It destroys the cilia, and there are superimposed bacterial infections, which can cause superimposed pneumonia. It can cause also superimposed otitis media. That's why vaccines are important. So if you prevent getting this disease, you will not have to use antibiotics. Another important thing is breastfeeding. So in those babies who are breastfeeding purely, they have decreased infections because they get the antibodies from the mother when they breastfeed. Another important thing is safe food preparation and handling. You get a lot of organisms to contaminated food, and also water. Your water ideally should be distilled because sometimes if you just get ordinary filtered water, the organisms don't really die. Okay, another thing is you have to build your resistance, meaning proper nutrition. So it's not only your vitamin supplements, you have to eat the correct vegetables and fruits all the time.
Dr. Gozali, really quick question. How difficult is it to treat a patient who is infected with an antibiotic-resistant bacteria?
Oh, it's really very hard because sometimes they already have they have ESBL, extended spectrum beta lactamases. Sometimes you have only 1 or 2 antibiotics left. No, but actually there are times that we had a patient that there was no antibiotic already that will work on this patient, and the patient expired. So it's really very difficult. So please try to follow the preventive measures. Also, one more thing is to eat organic, because now many of our food, like for example, the pork or chicken, they give antibiotics. So in animal agriculture, they also give antibiotics. That's why even if you don't get exposed to antibiotics, our children are sometimes resistant because of the exposure in the food.
Okay, very good advice. So just to reiterate the importance of trying to prevent this antibiotic resistance. And with that, we'd like to thank our guests, pediatric infectious disease specialist, Dr. Maria Lourdes Gozali, and family community medicine specialist, Dr. Ana Gia Limpoco. Antibiotics can save lives, but they pose a bigger threat when misused and overused. So taking antibiotics when you don't need them can only increase the chance of antibiotic resistance. And while they are priceless when it comes to bacterial infections, at the end of the day, your doctor knows best because they prioritize your health first and foremost. So take antibiotics only when they are prescribed to you and when your doctor advises you to. This is Dr. Freddy Gomez. Thank you for watching MedTalk Health Talk, only here on CNN Philippines. Stay safe, everyone.